Okay, good morning. Let's talk about the gross anatomy of the clavicle, scapula, and the humerus. Three important bones of the upper limb. All bones are important, but uh, the clavicle is one of those bones you're going to be talking about first when you're learning anatomy for the first time. Okay, now these are three bones from the bony framework of the shoulder and upper limb that are designed for mobility first, then strength second. Now, for this clavicle, the clavicle is the only horizontal bone in the body. The general features is that it is S-shaped long bone. It is subcutaneous throughout, okay, and is most commonly fractured, and of course act as stunt holding the upper limb away from the trunk. Now, parts of this clavicle is it has a medial end, also called the sternal end. Okay, this sternal end is rounded and bulky, articulates with the manubrium of the sternum and the first costal cartilage. Then it also has the sternoclavicular joint. That's the sternum and then the clavicular joint. Okay, sorry. This joint is called the sternoclavicular joint. That's between the sternum and the clavicle. Then we also have the lateral end or the acromial end, also called is flattened. That one is flattened, articulates with the acromion of the scapula, and of course it's called the acromioclavicular joint. Then the clavicle has a shaft. Okay, now the medial two-third of this shaft is convex. The medial two-third is convex, while the convex anteriorly, sorry. Then while the lateral one-third, okay, is concave anteriorly. So which means that anteriorly it is like this, then that's the medial two-third, while the lateral two-third is like this. Okay, now let's talk about the inferior surface. That's inferior features. And now it has a conoid tubercle, okay, that serves for the attachment of the conoid ligament. It has a trapezoid line for the attachment of the trapezoid ligament, and then it has at the midline it has a subclavian groove. This one is for the subclavius muscle. Okay, now, and it also have an impression called the costoclavicular impression. This costoclavicular impression is for the costoclavicular ligament. Okay, now what are the muscle attachment? The muscular attachment to the clavicle is the sternocleidomastoid muscle, that's to the medial, okay, the pectoralis major muscle, the deltoid muscle, that's the anterolateral part of the deltoid muscle, and also the trapezoid muscle, which is the posterior lateral aspect. Now, what are the clinical notes of the clavicle? Number one, it fractures commonly at the junction of the medial two-third, as the midline, and the lateral one-third. It protects subclavian vessels and the brachial plexus. The brachial plexus are a series of nerve that supplies the upper limb. We're going to be talking about that later on. Now, let's talk about the scapula. The scapula is flat and triangular bone on the posterior thoracic wall. Okay, this bone here, or what is called the shoulder blade. It has surfaces. Okay, let's talk about the surface. It has a surface. It has a costal surface, also known as the anterior surface. Okay, now this costal surface has a subscapular fossa for the subscapularis muscle. Okay, then it has a dorsal surface, okay, also called the posterior surface for this. Then there we have the spine of the scapula. We have that divides this posterior surface into two. That's the supraspinous fossa and the infraspinous fossa. This infraspinous fossa, the supraspinous fossa is for the supraspinatus muscle, supraspinous muscle or the supraspinatus. The infraspinous fossa is for the infraspinatus or infraspinous muscle. Now, talking about the borders, it has a superior border. This superior border contains the suprascapular notch. Okay, then it has a medial border, which is also known as the vertebral border, and it also has a lateral axillary border. Then it has angles, okay, because it's a triangular bones. It has angles. It has a superior angle, okay, it has an inferior angle, it has a lateral angle, or this lateral angle is also called the glenoid angle by some people, and this is because the lateral angle expanded into the glenoid cavity. Then let's talk about the process. It has some processes. For example, it has a spine that continues laterally as the acromion. Okay, it has an acromion, okay, that articulates with the clavicle to form the joint between the acromion and the clavicle. Then it has another process called the coracoid process. This one is the hook-like process for muscle attachment and ligament anchor. I call it the promiscuous process, all right, or the prostitute process. Okay, now there's a glenoid cavity. This glenoid cavity is found at the lateral aspect of the or the lateral angle of the scapula. It is shallow, it's very shallow and pear-shaped, articulates with the humeral head, then of course deepened by the glenoid labrum. When we meet and I show you in the lab, I will show you, that this joint, this joint under normal condition is not supposed to be a strong joint, but because of the surrounding structures around it, okay, they make it a very strong joint. Now, what are the muscular attachment to the scapula? Of course, we have the rotator cuff muscles. The rotator cuff muscle, also known as the sit muscle, SITS. Okay, the supraspinatus, the infraspinatus, the teres minor muscle, the subscapularis muscle. Then that's the sit muscle. Then we have the deltoid muscle. It's not part of the sit muscle. We have the deltoid muscle. Okay, we have the trapezius muscle. I've mentioned this. We have the serratus anterior. I don't know if I can remember. We have the rhomboid muscle. We have the long head of the bicep muscle, of course, from the supraglenoid tubercle. And then we have the long head of the tricep. That's from the infraglenoid tubercle. Now, what are the clinical notes? What are the clinical notes to the scapula? Well, there's something called the winging of the scapula. Once there's an injury to the long thoracic nerve, the long thoracic nerve supplies it. So once there's an injury to the long thoracic nerve, definitely you're going to have a winging of the scapula. Okay, then there's also shoulder dislocation, which of course involves the glenoid tubercle. Okay, so I think my wife is here. I think we need to move. Maybe the next video will be about the humerus as a bone. So thank you. See you guys later.